Certainly the most severe complication for a diabetic is what's called peripheral neuropathy, and that's a patient who, because of long-standing hyperglycemia or diabetes or elevated blood sugars, loses sensation. We call it loss of protective sensation. So they can't feel minor trauma on their foot that you and I would normally recognize and certainly avoid.
With a diabetic, you have to approach them systematically. So you have to make sure that their blood sugar is controlled. You have to make sure that there isn't any excess pressure going on with their wound. You have to look and evaluate their circulation. And these are things with a common person who might have a wound or a traumatic injury, but at the same time, the diabetic might have more issues with these things, and that's why it might take them longer to heal.
We have several advanced therapies that we can offer here at the Wound Center. Technology in wound care is exploding. All the latest therapies that are available for patients are offered to them here, and that, again, with hyperbaric oxygen therapy, we're really able to offer patients healing rates that, are close to 90%, and that's really a testament to the quality of care and the different disciplines that work together to heal wounds here.
For prevention for a diabetic, as I always tell the patient to evaluate their feet at least once a day. So they want to look at the bottom of their feet and the top of their feet. They're looking for redness, irritation, blisters, drainage that they didn't notice that they had before, bruising, and if they have this consistent evaluation of their feet on their own, using their eyes and their hands, they then are being more protective and more prophylactic on making sure they don't have a wound that just suddenly gets out of control.
If patients just check their feet every day and picked up things early, we would certainly be able to reduce the number of wounds.
I tell them to make sure that they moisturize their legs and their feet once a day or twice a day, depending on how dry and scaly their skin is. The issue is if their skin is very dry, it'll crack, and when it cracks, it could potentially open, and then that's the source where you could get an infection. If you notice that your shoe wear is causing you blisters or irritation, then you have to respect that and not wear that shoe. A lot of people will continue to wear a shoe that they should not wear just because they like the way it looks, or they've invested the money in it and they don't want to give it up, but really they should.